Welcome to the Vet Med Wellness and Leadership Podcast, where we discuss central challenges vet med leaders face, such as burnout, stress, and difficult interactions with clients and staff, just to name a few. In each episode, you will hear about actionable solutions that you can apply to your practice and invitations to connect with fellow leaders who are passionate about improving the wellness of the vet med profession. By subscribing, liking, commenting, or sharing this podcast, you are helping more veterinary professionals find the resources shared in these episodes. Thank you in advance for listening and supporting this show. I hope you enjoy it. Hey everybody, Crystal Stokes here, and joining me today are Dr. Laura Garrett and Dr. Ruthanne Chun. And we are here to discuss the topic of intentional communication. But before we dive into the topic, I want to take a few minutes to have our guests introduce themselves so they have a really interesting background of what led them here to this topic today of intentional communication. Ruthanne, is it okay if we start with you?
Yeah, I'd love to start. Thanks. So Ruthanne Chun is my name. My pronouns are she, her. And I am a medical oncologist by training. So graduated from vet school back before the turn of the century, got into vet school because I've always loved animals and kind of recognized along the way how much I love people as well. I love talking to people, and became an oncologist because of that professional bond that you really develop with a client. They want to know more information. They want to do what they can for their animals. Sometimes that's not all of the things, and that's okay. But being able to help them understand what are their options, what's going to be best for them and their animal. So I've always loved talking to people. And as my career progressed, started working in an academic setting. Laura and I actually worked together and taught euthanasia, communication skills. And that was kind of before either one of us had really been trained on, maybe even before there was the Institute for Healthcare Communication doing training for veterinarians and doing train the trainers. So once I went to that and just had this whole new world of tools opening up for, this is one thing that you can do to build a connection with a client intentionally or a person. That was like magic to learn these specific skills to think about using really intentionally. And shortly, a few years after I took that course, I became the Associate Dean for Clinical Affairs at UW-Madison, and that's where I am today. And being the hospital director in a teaching hospital, so many opportunities to practice intentional communication skills with all the constituents, all of the stakeholders. And I just am a believer in being able to use communication skills very intentionally, I think brings me faith in humanity because I can learn and try and understand where the other person is coming from, and being able to teach mostly veterinary students, but certainly residents, postgraduate veterinarians. What are these tools? How can you use them? Why do you use them? And that we can all do better. We can all learn to be better communicators through using these tools. So
I agree.
A little bit of my story.
Thank you, Ruthanne. And how about you, Laura?
Hi, Laura Garrett. I'm a veterinary oncologist at University of Illinois. And I got into veterinary oncology sort of circumstantially because I wanted to be in a certain place where that was the residency that they had that was the strongest residency. So that's why I applied to become an onco resident. I love it. I can't really imagine if I'd gone into internal medicine, I probably would have been one of those people who got double boarded. I didn't go into it because I liked people, but I did like talking to clients, and generally I got along with clients. And then there are, like the 10% of people that are terrible that it's clearly not my fault. It's just that they're terrible. And so as Ruthanne and I went our separate ways and then rejoined forces teaching at a university for about 8 years together, we did start communication rounds with students completely from experiential learning. We'd both been very successful practitioners for quite a while at that point. let's talk about what struggles did you have in clinics today and how can we address that? And I think some of what we did was probably really good and some of what we did was probably not as good. And you can't memorize what to do in every single interaction specifically, like, well, this is what you do here and this is what you do here. And that's how learning a set of broad skills that can be applied in every situation, because they speak to the need for people to be heard and understood and valued, is what learning these communication skills taught me better how to do. I could see how, I do some of that naturally, and I really don't do some of that. So it's in those challenging situations with people where I don't naturally know what to say, is I can look and pull out one of these skills and it helps me through the moment. And it has actually helped me really like communicating with people more. And that part of what I do now has grown to what I like the most. I love seeing clients who are struggling and who people say, oh, well, that client's just, they're a challenging person. It's like, all right, well, then I'm up for the challenge. And then teaching others how to do that, because the whole health and well-being aspect in veterinary medicine is such a struggle. And people go into veterinary medicine because they love animals and they don't have the tools to talk with people. And it can really be a draining aspect of the profession. So that helping bring this to people in the profession, I like talking about oncology. I love teaching about cancer, but the communication skills is more helpful across all aspects of what we do in veterinary medicine.
And life, I'll say, and life. Although it's harder to use it when you've been married for 25 years.
It's so true. It's just like working with any human. And I appreciate both your stories so much, because I see this conversation happening over and over again, where so many of us come into vet med and they say, we're here because we love working with animals and not so much people. I was even one of them. And I think that for many of us, for sure myself, that feeling of like, I don't really like people came from a sense of not knowing. Like I felt intimidated. I didn't understand them. Like weird stuff was happening that we couldn't figure out. When we don't have mastery, I think that those of us who are attracted to things like medicine, we like to be good at things. And if we're not good at it, we don't like it so much. It's not a good feeling, like the perfectionistic side that wants to be great. But if we can learn the tools and the skills to be good at communication, it suddenly becomes really enjoyable. And that's a really interesting transformation to have. Like if I were listening to this back when I was 20 years old and somebody said, you could go from feeling like you hate working with people to you love working with people just by mastering some communication tools, I'd be like, you're lying. I wouldn't believe it. But to be on the other side of it, we're kind of the proof is in the pudding type people. Everything it sounds like you've always kind of enjoyed working with people. You might have been one of the lucky ones. I think I was more like Laura, where it came to me slowly for humans to become my favorite species.
I would say humans are my favorite species. I like people.
Yeah. I mean, the people that were nice and that I bonded with that liked me were great. And that really was most of my clients. Like, I think because I liked what I did and I am hopefully still good at it. But, even as an intern, I remember sitting with a cat at midnight and them telling me their story about how this cat used to travel with them. And like, she was there, sit on their dashboard when they drove places. This cat loved driving. And it was at the end of life evening. And I think it was 2 a.m. by the time we euthanized the cat. And that was just it's still, decades later, I remember that night very clearly. So that sort of thing has always been something that I found fulfilling and that I like to be able to help people like that. The client that refused to treat their dog that was dying of their vicious dog that was dying of GI lymphoma in ICU that just wanted me to put rescue remedy on its nose and refused to do anything while the dog suffered. The only skill I had at that point was to accuse the owner of making her dog suffer. And I'm sure I was insufferable when I did it. And I felt like I was defending the dog. And now looking back, there are so many other things I could have done to connect with the owner to help end the dog's life more peacefully, quickly, or get the dog treated. So that kind of client is where you really need those skills.
I think, the other thing about learning communication skills and using them differently is that it's so personal. We talk all the time. I know how to talk to people, right? We grew up talking to people, communicating, interacting with others. And when we get into those really, really high stakes situations where we can see something so clearly that this animal is suffering and he's dying a really miserable death. This just is terrible. And then that anger comes in, we get mad, understandably and justifiably. And that's even harder than to make that connection with the client. And there's Laura and I talk about righteous communication sometimes, where I know I'm right and here's the right thing to do. And how does that land when somebody's telling you, well, this is what you really need to do?
Right.
It doesn't land. And so how do you, in that moment when you're so like, oh my God, this is terrible, reach down into yourself to say, I need to be the grown up in the room and try and find a way to connect with the client, empathize with them, recognize where they're coming from and acknowledge that and let that hold for a moment. Mm-hmm. And then say, what are your hopes for her?
Yeah. So I think these tools are the solution to helping guide someone that righteous communication paradoxically makes you less effective. And so that's the reason you're so adamant about raw food being bad, especially for dogs on chemo, is it's very risky for both the dog and the clients in the house. And the more adamant and righteous we are about it, the less, especially if the client doesn't know us, then you're just the jerk. And why should they trust you? I have conversations with students frequently about, you say, oh, the breeder brought in the dog and everyone rolls their eyes. Or, when the client says, well, my breeder says, and people really get vets and vet staff, right, get upset about that. It's like, well, what did I go to school for? Like, okay, let's step back. Why? And so I'll just say, what reasons do you think that client has for trusting the breeder? And amazingly, people come up with reasons all the time. They have a longer relationship. They've spent a lot of money with the breeder. There's a pride thing. They may have had other dogs through the breeder. The breeder may be their breed expert. Like, there's tons of reasons. Okay, so don't take it personally that they trust their breeder over you. Give them reasons to trust you too and form a partnership. Yeah. Versus being righteous about, this is not a problem with this breed, right? You trust my degree. You shouldn't listen to your breeder.
Exactly. What I like that you're framing so well is, I think most people that are attracted to this conversation are probably thinking, I would really like for my interactions with these more challenging clients to be better. This is the part of my job that really is a drag. I get anxious whenever I see Miss So-and-so on the schedule, knowing this is going to happen. And it'd be wonderful to have this sense of comfort and mastery, or just more confidence going into these conversations, and feeling like we might be able to have a better outcome, that we can connect with a client or even a team member that might be upset. So I just want to set the stage that what we're trying to offer here is a pathway forward to gain more confidence and some skills that you can use. You said were broadly applicable across many different types of challenging situations. You don't need to memorize, when they're angry, do A. When they're anxious, do B. When they're crying a lot and huffing into a paper bag, do C. It's like, no, we're gonna go over some skills here that are much more broad. Before we dive into what it looks like, I know I would really want to know immediately, because I'm very impatient, but can we first just kind of define intentional communication? Because that's the topic of today. And I'd love to hear how you all frame it. We don't need like the Webster version, but it could just be from your experience, how you like to define this when you're sharing it and teaching it to others. How about Ruthanne? We'll put you on the spot.
Sure. So when I think how I would define intentional communication is, it's sort of a meta process of, I'm interacting with somebody and I'm thinking, how is this going? Are we connecting? Are we on the same page? Do I understand what they need, what their goals are, where they're coming from? And what can I do to try and better understand where this person is coming from, and specifically in the situation with a client, build that kind of that trusting relationship, that professional relationship that we really have to have with a client. So what are the tools that I can use intentionally to build that strong, positive professional relationship?
Great. Yeah, it's one of the words I really don't like lingo when it comes to learning new things. It's very linguistic language is very off-putting. It's isolationist, like, well, we know the lingo and you don't, sort of a thing. And intentional communication, when I first heard it, I was like, of course I communicate intentionally, right? I'm not just like not intentionally communicating. So I'm glad you asked, what does it mean? That's one word that I do use a lot. And it's the cliche of, it's not just what you say, but how you say it. And it's not just how you say it. It's everything around the actual information you're sharing. So it's that listening piece. It's the how you give someone space, both physically and emotionally, to voice their view without being judged. I mean, all of those things. So when I would intentionally communicate, sure, I'm going to give you the survival time of lymphoma, and that's very intentional, but that's not what we mean. It's not the information part. Is this client still listening to me as I'm looking at them? Do I need to take a break? Do I need to check in? Paying attention to all the things on the outside of the actual information sharing.
Got it. It's almost like you have the content, right? It's almost like you have like a book, like a children's book, and it has words in it and pictures in it. But then it's like, how are you reading the book and how are you interacting with your child with it? And are you making voices? And is it cozy and snuggly? Or, or are you just trying to get through it to get your butt to bed? Like, what's the energy behind what you're doing? And are you really reading the person in front of you and aware of what their experience is so that you can join them in it and take them somewhere together, like kind of become collaborative partners instead of feeling like you're warring against each other?
Yes, that's absolutely the goal, the partnership. And every client's going to come in with a little bit of a different background, different perspective, different needs, different experiences from what you have as a clinician. And so how do you make a connection with that specific person?
I love it. So what if we got into, we could go a couple different routes. One could be to talk about some of the tools, like if you want to go into teaching mode a bit, and I can be your audience of some of the concrete skills or how you like to map this out. So if I were a clinician, I might be able to envision using this tomorrow when I go into the clinic. Would that be an okay route to go? And you're welcome to use examples too, if that helps paint the picture.
Sure. And I will say, this is nothing that Ruthanne and I made up by any means. This is a very well-researched aspect of medical communication, that it came from the human literature. There's just endless probably amounts of studies now looking at all sorts of aspects of that communication in a medical setting. And then the veterinary world has expanded probably in the last 30 years and definitely the last 20 to 10 with ongoing studies at various institutions. And I think what Ruthanne and I have done is to take those learnings from various aspects, all from like literature as well as courses we've attended and then courses we've led. And I'll say that every time I teach this, in whether it's referring veterinarians, students, house officers, we've done some consulting at clinics addressing specific concerns. I learned from that. And then, that feeds what we focus on and how we present. So we did not make up the idea of open-ended questions. So as we're talking about the specific skills, the way that we think about them in various settings, including in leadership settings and in teamwork settings, there is support in the literature looking at those aspects. And then just, I think the way people engage with the material is different depending on the presenter. And so that's probably where we've worked as partners in this for a long time and feel comfortable trying to guide people to be interested in even thinking about doing this. Just going back to what Ruthanne said, communication is very personal. I think the people that I least like to talk to about this are my good friends who are on like GPs that I went to school with. And I just presented at a meeting. Several of my friends were at that meeting, and I was really stressed about them being there. I'm fine talking to people I don't know, but I know they're outstanding clinicians. Like, most of the people are great at communicating. And so, who am I to talk about this? And they afterwards said to me, that was amazing. And I learned some things. And I was like, wow, like that meant a lot, because people who have been in practice a long time, they just inherently do things very, very well. Again, back to that experiential learning. And I still feel like those days where you want to go home and have a drink or beat your head against the wall, it's like, you know what? These tools can help even experienced clinicians in those settings.
Well, and it's also the reminder of to just use those tools sometimes, to even just stop and think, because we could always do better. Like that's just being human, right? There's always opportunities to do better. You don't want to be perfect because that's not attainable, but you always can do better. And so it's that goal of, do I take the step of, I'm going to practice this? No, it just feels so weird and awkward, so I'm not going to practice it.
Yeah.
But then somebody else says it as an example, you're like, maybe I can try that sometime.
Right. And I think too, I this really helps me as a clinician, is to do a postmortem of my day. If I look at places where it didn't go as well as I hoped, and I just look at my side of the street of like, how was I communicating? Was I trying to drag them on the leash a little too much and show them my way? And there was resistance. They were probably digging their heel in, or they were just sort of avoiding it or shutting down. And it's like to look back on the course of a day where the communication, you just feel it wasn't really on point. There wasn't that alignment there. And to know these are tools you can have on your side of the street to affect what you can do to help make that view to do over a little smoother and to feel more collaborative in the process, and to not walk away feeling like, ooh, I don't think that went so well,
So Laura mentioned open-ended questions. I mean, we didn't make those up. They're a thing. They've been there forever. And why are they such a good thing to use? And when you're having that conversation and you feel like you're pulling somebody along and there's resistance, just dropping in that open-ended questions of, what are your thoughts about this? And then the really, really hard part is, yes, so hard.
Zip your lips. Do not talk. Let it linger. Because for those that can't see the video, we were doing the like zip your lip in hand gestures. So what Ruthanne is saying is that one of the universal tools that you can apply here is to use the open-ended question, which is a question that the answer would not be a yes or no.
Yep.
Isn't a one word or short phrase either. So even when did this happen is closed ended, which I used to think they're only yes or no. But if you think about it, the difference of when did you notice him limping versus tell me about his limp,
yes,
you're going to get a lot more information than I noticed it Tuesday.
Yeah. With Ken, can you tell me about the limping? It's like,
good one.
That's a yes or no question.
Yeah, that's what you're saying.
Mm-hmm.
Exactly. It's like they could rename it, like instead of open-ended or closed-ended, it's like long answer questions versus short answer questions. You're trying to, and I think this is very counterintuitive, because you think about it in a medical practice where it's so busy and you're like, oh my gosh, I have people waiting and waiting and waiting. We often default to, I just want a yes or no, so I can check my box and get you out of the room.
Yeah.
And realizing that's actually counterproductive if you're really trying to intentionally communicate with somebody and the outcome you're seeking is that you are collaborative partners. Then you actually want to defer to asking a question that will get more words, more sharing. You want to really know where they're at. So you're showing curiosity.
Yeah. So the open-ended questions and closed-ended questions absolutely have a place.
Yes.
Emergencies where there's 5 things I need to know. Even then, you still might go down the wrong path if you are asking closed-ended questions about the thing you think they came in for, and the thing that's really concerning them is something else. And then you've spent all that extra time investigating the thing that really isn't the thing. Also, there's a sense of being interrogated, that's off-putting. People want to feel like their thoughts matter. I mean, their thoughts do matter, but they also want to really feel like they do. And by asking things open-endedly, it gives them a chance to express their thoughts and feel valued, which is money in the bank of that relationship that you're trying to build. So one of the other concepts, and there's papers with titles of this, is relationship-centered care. I'm like, well, what does that mean? Well, it really does mean that it's not just about the pet, it is about the client too. And relationship-centered questions, which relate to the human that's involved in the situation, is going to help create that bond, the sense of trust, help enhance their adherence to your recommendations. And there really are, it seems like just an open-ended question can do that. Well, we can maybe just talk really briefly about some of the core skills and know that you can use them interchangeably. So the 4 core skills that are most focused on, I would say, are empathy, open-ended inquiry, reflective statements or reflective listening, and paying attention to nonverbals. And then 4 other skills that are tied very closely. One is pausing. So there's that ask an open-ended question and then pause. Chunk and check as a way of providing information. So say a small amount and then check in. Ask, which seems like isn't that open-ended, but asking is so important that it's a reminder to not just ask questions during history gathering, but to actually ask open-ended questions. Like Ruthanne said, what are your thoughts on that after you share something? And then signposting, which is kind of giving an outline or saying, well, first I'm going to do this, then I'm going to do this. That'll have time for any questions. Even that kind of signpost may keep people from interrupting you when you're kind of in a chunk and check phase. So those are 8 skills that we'll talk a lot about. There's a bunch of other things, right? It's kind of, people talk about the toolbox that you can pull something out of when you're in a situation. And especially if using any of these, so the intentional communication piece to me is using those skills intentionally. Like looking at someone and thinking, they seem really uncomfortable. I'm sure they're sad their dog has cancer, and I'm just going to keep talking about cancer. No, I'm going to stop and say, how are you doing with this? Or what are your thoughts on what I've shared so far? So that when they look like a deer in the headlights, I don't just keep talking and wasting time when they need a moment to gather themselves. And that's where I'll use those tools intentionally, and they help with the overall communication in a situation.
I'd love to share that I wonder if those who are attracted to like the specialty of oncology might have a natural kind of inclination to develop these skills. There's an oncologist here in our town in Santa Barbara, and I've shadowed her in several of her client cases just to watch communication and see if we can provide any feedback on that. And she is masterful with these things because many of the conversations kind of have a palliative care route. If it's not immediately, it might be going there at some point. And to be able to be very empathic and tender with the person. Also seeing that the information, especially in that first visit, is very overwhelming because it's just like, they're just going cancer. And it's like, oh my gosh, that probably means death. And she's slowing it down. Like, this is where we're at here. And she's using the whiteboard and little chunks and checking in and like getting down their level, like kneeling down and being really slow, and just such a organic way of meeting them where they are, like tone of voice. If they're a little bit lower and slower, she'll go lower and slower and just pacing along with them. And so I wonder if you think that perhaps people that work in professions that do have more of the palliative care aspect, does it kind of draw out some of these capacities to communicate this way because you are dealing with such tender moments so often compared to maybe some of the other specialties?
I think that there probably is some natural tendency towards an area of specialization that you are better at. And, that's one of the things that did draw me to oncology is I liked explaining things to clients and working with the clients that that wanted to know more and wanted to understand and could choose a variety of different options. And now looking at every interaction and how you can intentionally create a connection with clients, I do see that you can use it everywhere. But yes, I think that oncologists as a whole, very generally speaking, tend to be good communicators because there's a lot of information that you have to share and it is highly nuanced. There are options that clients need to pick. And oftentimes we are helping them prepare for the end as well. I mean, we're all going to die at some point. We're all going to die. But we want it to be planned and we want it to be thoughtful and we want it to be, it's sad no matter what. And you can still make it a positive thing, reframing what is our goal here.
Right. And I would agree that many oncologists are very good at communicating. And I would also bet that most oncologists don't use intentional communication skills because we just didn't learn it. And it's that they are naturally empathic and can sense that, oh, this person needs a quieter tone right now versus the thinking, what do I need to do? And I mean, I know that was true for me. So again, most of my clients liked me very well and I liked them very well. And those clients that were so impossible, that was just the 10% or whatever that those people are just going to be difficult. And I mean, I think that 10% might have gone up to 30% now with social media and post-COVID and everything, except that those 30% really are like 1% maybe of people that truly there's no way to connect with them. They're, maybe there's pathology or they just truly are never going to become part of a respectful, caring team. But most people truly that are acting terribly aren't terrible. They're acting that way because they are in a terrible situation.
Yeah. I love how you reframe that. They're not difficult clients. They're clients in a difficult situation. And one concept that we talk about a lot at Wisconsin is this idea of cultural humility. And that is understanding who you are, what makes you who you are, the family, your values, how you grew up, the food that you eat, the beliefs that you hold. They're very, very deeply personal. And knowing that everybody else that you interact with in the world, even your own family, will have slightly different perspectives on that. And when you're working with somebody, providing care for their animal, whether it's wellness care or they're ill and they need serious interventions or discussions about serious interventions, taking the time to hear what is important from that client's perspective and why will help you be less. It helps me be less irritated with them when they're like, I can't afford that. I work second shift and third shift sometimes. I got 3 kids in school. I don't know how we're going to put dinner on the table next week. And I can't afford this. Yeah, that's hard. Bless you.
Thank you. I muted myself. I was wondering, so for sake of really helping audience members walk away with something they might be able to just play with today, because I realize this topic is huge. You're not going to learn everything about intentional communication from a podcast, but I hope that at least what's the whistle to start looking into that and looking into trainings. But if we could perhaps showcase something that you think might be most helpful to somebody where they might be able to, again, play with it today or tomorrow in their clinic. One that you had already mentioned was, using those open-ended questions to really try to get a deeper response. Is there another one that you might suggest if they could come away with 2 that are really strong, that maybe you use most often or find most helpful?
And intentional, again, the intentional word, intentional expression of empathy is something that is very difficult and really does require practice. And the first time you make an intentional empathy statement, like, you look really worried feels like marbles in your mouth. Like, why you would never say that to someone on the street. Although actually now I will say it to people, like if you're at a airport and the person behind the desk is stressed out and was just in a fight with the person ahead of you, I will say, boy, it looks like you're having a really rough day. And let me tell you, their whole demeanor changes. I still haven't gotten an upgrade, but they could, potentially. I mean, really, it's just amazing. I'll be like, what time did you get her this morning? Oh, I got her at 3 a.m. And they just, it's just another human being trying to get through life. Back to what Ruthanne said about finding more faith in humanity. It's because we are all struggling in very similar ways and in very different ways. So we can't assume, but most people that seem really unpleasant, again, really aren't that way. And so you can, so intentionally expressing empathy, I got on that sidetrack because it really does work, as Ruthanne said, even outside of the clinic. And in dealing with, say, we've talked about clients, but even with, staff and technicians, if you need to have a conversation, a corrective, potentially feedback conversation with someone, and that's a whole other topic. First starting with something about how hard it is to be on the front lines at the front desk. Mm-hmm. That's a terrible job. And that is going to help if I'm the hospital director, it's going to help my employee hear me better and know that they're supported. When I say, I can't imagine doing your job, this is so overwhelming. And again, I see how hard you work at trying to connect with clients. There is a situation today that I'd like to chat with you about and see, how we could improve it in the future. And so that empathy about how hard something is can help the rest of the interaction. And so that's it, the finding. So empathy, I'll think of it briefly or teach it briefly as being seen, being heard, and being accepted. And so to make an intentional empathy statement, if you can't come up with one, especially someone with whom you don't naturally empathize, mm-hmm. The client is being unpleasant and angry, or that they just yelled at your staff and now you have to talk to them and you already are like, this person sounds like a jerk. I'm going to say seen, heard, and accepted. And so I might say something like, boy, it sounds like you've been having a really rough few days. And my inside voice is, and you're making it rougher for my techs, right? But that's not the part ideally that you say. It sounds like you've been really having a rough time. It sounds like your experience here isn't what you were hoping for. Those are all sort of both kind of empathy and reflecting like the situation. So if it's speaking to emotion, it sounds like you're really upset about how things went. That's kind of empathy versus, it sounds like, you were disappointed in, I guess disappointment's also emotion, but that you were expecting, this visit to only take an hour and it took 5, that is more of a reflective statement, but they kind of cross over. And empathy can really help a client to connect with you and listen more to the rest of what you have to say.
So when emotion is acknowledged, it tends to dissipate, both in ourselves and in others. And how Laura's describing that, those empathic statements, those 3 other core skills, open-ended questions, attention to nonverbals, and certainly reflective listening and reflective statements are all incredible ways to build empathy. And so if you can connect with your client and they can feel like you care about them as a person and that you are there as the veterinary professional to help them with their animal, that's why they're there. That's why they're seeing you. That's my goal. And the only way I'm going to be able to do that successfully is if I can connect with you. You may not be able to do all of the things. Not many people can do all of the things. That's okay. What can we do? And where can we work together to build that partnership so that I know you are going to give these antibiotics. And this is something that you understand is going to help your dog's bladder infection get better That's much better than the cranberry juice that you've been using. Cranberry juice is fine. He really needs antibiotics this time.
Could I put you on the spot? You can say no, don't worry, but could I be a client in a challenging situation and have you just do a quick role play with me? What do you think?
I love it.
And maybe one person can be the doctor interacting with me, and then we stop, and the other person can say, this is where she was practicing empathy. Did you see where she did the reflective listening? Did she pick up on the body language? Like, that you could do the narrative part. Because I think the thing you were highlighting with intentional communication is almost like this little owl picture I have. There's an observer self, like the owl outside of that's watching you interact with the client and kind of guiding, like, ooh, let's be really thoughtful about how we're doing this. That mindful awareness where we're not just in the moment reacting, but we're really stepping back from it. And it takes a little extra effort, but let's try it. Could I be the client that you were mentioning earlier that has my dog on a raw food diet?
Yes.
Yeah. And have we staged the visit? Like, it's just like a first visit where I'm just now getting maybe a cancer diagnosis, and we're just going over how to move forward. Like, I'm getting the news, so maybe you've given me the information, and I'm a little bit overwhelmed with it, but I'm kind of a little upset and gripping onto, but the raw food diet, I read that it was the best. And the breeder also said it was the best. And he's already sick. Why would I give him this shitty canned food? It's just going to make him sicker. Like, I'm really frustrated if I was that. Is that okay? Is this a client you've seen? Okay.
Which do you want to do, Ruthanne?
You want to flip a coin? I'll do either. You can be the doctor. Or do you want to be the observer?
No, I'm fine with either too.
Okay. All right.
All right, Dr. Laura.
You want me to be the doctor?
You want to start again, I can, or you can just go for it.
No, I think I can remember. I think. All right. So cancer diagnosis, you've been feeding. Why would I switch to? So I have said at some point, it's safer to switch. And then you're saying, why would I switch? So we're kind of partway in the conversation.
Yeah, let's say we're like midway through. Like, you've been kind of going over the treatment options with me, been mapping out kind of the next steps over the course of the next month or week. And one of the recommendations you gave was to adjust diet. And then my response is getting quite flustered. My hands are up, and then I'm crossing my arms, and I'm just really frustrated because all the information I've read online and what my breeder has told me is this is definitely better for my dog's well-being. And I'm worried that they're already sick, and I don't know how much time we have left. And I'm afraid that if I put them on this diet, they're just going to like tank even faster. Like, how do I know?
Can I add something to the scenario? Mm-hmm. That your dog's got lymphoma, multicentric lymphoma, and you want to treat.
Yeah, and I'm really motivated to treat, right?
Yeah, you're motivated to treat, and we've talked about the CHOP protocol, and so it's. I'm just implying that it's chemo intense.
Yeah.
Yes. Right.
Okay. And so we're going to have all sorts of commentary here. This could also be. I just thinking for vets that are watching. I don't want this to be so cancer centric. Like, hopefully, this will be an example. And it could be a dog that is just any dog that's on a diet that you would like to change. I think that this is a great example of a specifically very challenging situation. But this isn't just about cancer cases or euthanasia cases. Like, these skills can be used day in, day out in practice to make conversations go smoother. Okay.
Yeah, and then the other thing that probably UI, like a UTI, right? And you're right. Like, well, some of the things we could change up here, and the person, it could be just something that's very common.
Yes. And then non-verbally, which I can't do on a podcast or on a Zoom meeting, is one thing I do intentionally is I will sit down by the person, but at an angle. Not this angle, this angle. So if you're in a chair here and you're looking this way, and there's usually like two chairs next to each other, it's really weird to sit down right next to you because then you're here. So I'll scoot the chair over a little and I'll sit like this. So an angle of facing non-verbally creates synergy, and definitely not like this, because then I'm already opposing you. Yeah. So when you're sitting like this, it's harder for you to do that when I'm right here. And I might even as long as I don't feel at risk, I might even lean in a little and be like, just a little more of a lean forward towards you and say, so it sounds like you have been taking care of him so well for his whole life, using special diet as well. And now he's diagnosed with cancer. That is so unfair.
That's exactly how I feel. This is ridiculous. I thought I was doing everything right, and I just can't believe this is happening.
Yeah. And it is shocking. I can't imagine how scary it is. It does sound from our earlier conversation, you're interested in going ahead with chemo. Mm-hmm. And that's great. That is going to be something that can get you more time. I mentioned a diet change, and it sounds like you have some concerns about a processed food diet. What's your understanding of what I shared as far as maybe why switching that diet is something to think about?
Honestly, when you're talking about it, I just sort of blanked out. Like I was just overwhelmed with all the information, and I just kept kind of thinking back about all the stuff that I've read. It's just processed food is bad for humans too. And I just kind of get stuck on that point. It's just like a big stop sign in my head.
Absolutely. Absolutely. And you were hit with a lot of information and get that kind of buzzy noise in your ears. And and especially when there's some, seriously, concerning information to share. The diet is something that we can spend more time talking about. My main reason and there's many diet options on the market. My main reason for wanting to switch from the pure raw food diet is related to side effects that can occur with chemotherapy. And so there's a real health risk. It is, we could talk more about the range of diets. There could be some not raw diets that are less processed that could fit your needs. Mm-hmm. So would it be okay if we talked about some more of those concerns in detail?
Yeah, that'd be great. Like I'm not stuck on the raw part. I just don't want it to be super processed. So I think that's a good middle ground.
Okay.
You did. See, that's it. Like I felt like you joined me where I was, and then we kind of were walking together to a new place. And I really loved that beginning that you started with of you hit the nail on the head perfectly. If you've invested so much into like everything healthy for your pet, and now you're here at the cancer diagnosis, and how that is it's like a 180 of what we expected. And that kind of the bottom is falling out, and you've done everything right, and it didn't go the way you hoped. I thought that landed really well for me.
So that was a beautiful empathic statement. And it wasn't, there might've been some reflection aspects into it, but the way that Laura said, I can't even imagine how you are feeling about this right now. So many of us tend to say, oh God, I understand exactly what you're going through, and this is such a shock. And you're saying that because you're trying to make the connection, and maybe you do have your own understanding of what that felt like, but it takes away from that other person's experience when you say, oh, I understand exactly what you're going through. So that the way she said, I can't even imagine how you're feeling, because you've done so much to try and keep them as healthy as possible, doing all of the right things that you've learned about.
So subtle, the subtleties of this, of like your own experience. I can't imagine what it's like, but I see you. I felt very seen, and that my emotional response was valid.
And go ahead. I was just going to say, Crystal, you de-escalated so fast. I wasn't sure if you were going to keep pushing back on it. But I think it would have been hard to continue to be really mad and fighting against her when somebody's just made such a nice empathic statement to you.
I'll say this too. I'm a hot-natured person, and I really like good customer service. And when I don't get it, I can be a little spicy. I am one of them. Like, I admit it. And these things work on me like magic, like almost immediately. I go from like a 10 down to a 2. Just all I need is one person to say, like waiting, for instance. I really don't like waits. If you told me to be here, I will be here. And if it's running behind, you should just call me and I won't come until it's time. Like, that's all you need to do. But if I come in hot, like, hey, all they have to do is just say something. Like, I see how frustrating this is. It was our bad. I'm immediately like, oh, it works immediately. So that was my true de-escalation, like what I felt was natural in response to what Dr. Laura said.
So one of the things that I do want to point out is that's both like attractive and part about this. So you said, boy, that's really subtle. There are subtleties. There are, you can use any of these skills in a mix of ways. And you shape them and pick the ones you're more comfortable with. Although I challenge everyone to kind of learn all of the main 8 because they're really helpful. Some people are like, I don't want to make an empathy statement. Okay, you got to practice that because those really help, but you can work into them. And so there's lots and lots of flexibility. There still are a couple of really big don'ts. And one of them is don't say you know how someone feels. And I understand completely is like saying you know. And people just go to that. Oh, I understand how hard this is. Ugh. You're trying to. So there's just a few things where if you try things and they really don't work, it really might be one of those subtle things. Mostly, there's some rules you can follow and they go really smoothly, but don't ever say you know exactly because people who are already upset are going to get more upset.
Well, and it diminishes their story and their perspective, right?
Yeah.
This is about them in this moment.
Yeah, you can't know how hard this is, would be the response potentially. Mm-hmm. And then the other thing, as far as the customer service, I'm sure you've had this experience where now the customer service people are told, like, especially on the phone, you need to say X, Y, and Z. And it doesn't work because it's so fake. So you can learn to do these things and you have to find some truth in what you say. So it was a minor thing, like, I don't know if it was Starbucks, that there was some bonus stars I didn't get. I was something, and they're like, I can tell how upsetting this is for you. And I was like, no, it's really not. I can tell that you're reading off a script. So
and how bored you must be.
Exactly. So if ye who are listening to this podcast think, oh, I hate when people reflectively listen to me, it's probably because they're not doing it well. Yeah. And I can tell you that people who complain about it, and then I talk to them and I reflectively listen to what they're saying, and they're like, yeah, that's right. Like, I just did it. So it's a skill set, just like suturing. And at first it may come across as awkward, but by following certain guidelines, you will get better at it and you will actually enjoy using those skills, and it won't come across as fake.
If you can speak your truth and you can say, I can see that you're really mad. You don't have to say, I can see how mad you are. I can see that you're really mad and that this is hard.
Mm-hmm.
Okay.
Absolutely.
That's the truth. And it's not on the script.
Yeah. And also I found, like, as a therapist, what's been really interesting to me is to watch how when we can throw a word like that out there, I can see that you are really angry, and a client might respond back for me and say, I'm not angry, I'm frustrated. And that tells me anger was not allowed in their family, right? Mm-hmm. Frustration is fine. But the word anger seems too violent. And even though they might be yelling and it's clearly anger to them, they're not ready to use that language yet. So I'm like, okay, got it. You're frustrated. Like, yes, I'm frustrated. Or we might engage things like on a scale of 1 to 10, where are you? Because I'm perceiving them at an 8, and they might say, well, I'm actually at a 4. And you're like, okay, so that's their reality. Yeah. I'm going to join them there. And I also thought, Laura, you did a beautiful job too I felt like you were really mining for the subtlety of what was bothering me. You didn't just like blanket statement, oh, she's upset about the diet. It wasn't just like a binary A or B. It's either raw or not raw. You were subtle about kind of a range of things, and you're kind of feeling out where I landed on the range. And I kind of, noticed that it's not just about being raw. It's just more about unprocessed. And there's a middle ground there. So it gave us more flexibility in the conversation where I didn't feel on the client side that you're pitting me into a corner of it's either not raw, it's raw or not raw. And if you're a naughty and non-compliant client, unless you stop that raw diet, I felt that you were very curious about what my intention was behind the diet and why it mattered to me. And then as I was able to share why it mattered, you were able to pick up on the subtlety it wasn't the raw part that mattered. It was more of like the health component, what's best for my pet. And you can align with me what's best for the pet, especially during chemo is a special time compared to non-chemo. That was also, I think, helpful that you were just curious about why it mattered to me. Yeah.
Yes. And that's really with an open-ended question. So if I am sitting there like, oh, I can't believe I don't really care what this person thinks. Hopefully I do care, but I'm like, what am I going to say to this? So open-ended questions, what, how, tell me. Are
the other thing you did, Laura, that I think is so important is you asked permission. You said, is it okay with you if I tell you a little bit more about this? And when Crystal grants you permission to do that, that opens up her receptiveness to you actually talking more about it. Right.
Yeah.
So that's another really nice, subtle thing.
Yeah. Because I could have said, no, I'm too overwhelmed right now. Like, I can't take any more information in. Please don't tell me about the diet. You know, like some people will say that they're flooded. So I think, that permission part was beautiful too.
Yeah. And that's an ask piece that isn't open-ended. That is a closed-ended question. Would it be okay if? But you're right. Most of the time people will say yes because they feel like you're handing them the reins. You grant permission, and as opposed to me shoving information down your throat. And if you did say no, I would not talk about it. That's right. And then we'll talk about it later. Fine.
Yeah.
Right. Okay. So we are coming down the home stretch of this. We could really talk about this for hours. It is such a fabulous topic. I want to say before we wrap up that I will post resources in the show notes that people that are interested in more about this can find those resources. But for those people listening today, for each of you, if I can ask you to have like 2 or so points that you hope listeners take away, if they don't remember anything else that we talked about, because we're all very busy humans, what would you like to leave people with today? And it can either be something we already talked about, or if there's something new that you just wanted to make sure was on everybody's radar, feel free. And can we start with, how about Ruthanne?
Sure. Yeah. I would say that we've talked about how communication is very personal, and it's something that we've all been doing for our entire lives. And when you went to vet school or you went to vet tech school, and you learned how to find the pulse, locate the bladder, do venipuncture, it was all so awkward. And just holding the syringe and figuring out how to draw the plunger back, adding in communication skills that you use intentionally can feel that awkward. And so maybe pick one. Decide I'm gonna work on just making reflective statements. A client says something to me and I'll say, it sounds like he's doing great. That's wonderful. Or it sounds like you're worried about this. Or it sounds like the limping's gotten better with the Rimadyl. Whatever it may be, just practice that. Don't try and do all of them at once because it can be overwhelming. But pick one, work on it, and then maybe pick a different one, the next day or the next week. So you can learn these skills, and empathy actually can also be learned. Yes, there are folks that might have higher empathy just naturally, and yet you can learn it. So even if you want to think that all people are jerks and nobody should have an animal, you can keep working on that and find some joy in being a veterinarian again.
That's great. Thank you, Ruthanne. How about you, Laura?
Yes, I'm laughing because Ruthanne and I are come up with things simultaneously, and you start talking about the individual as opposed to thinking about the skills. And that's what I was thinking too, there's a lot of self-realization that is needed to then use these skills and to recognize that mostly it's not about you as a veterinarian, and to not take things personally, which is so hard because it's so personal. We love what we do. And when someone says, if you loved animals, you'd do it for free, it's like, let me tell you about my student loans, and let me tell you, I wouldn't run, none of that's going to work, and we know it won't work, but it's hard not to get offended. And so that, again, is reaching out for that empathy to recognize, why is the person saying this? And then finding a way to respond, as you said earlier, Crystal, to respond and not to react. I can only imagine how scary this is to be facing the serious disease that can have a high cost with it, right? I'm not going to jump on, well, if I treated everyone for free, I couldn't keep being a vet. So not taking it personally lets me use these skills intentionally, and using these skills intentionally helps me from snapping and fighting to prove someone wrong. You can use these skills to actually help improve outcomes for animals and sort of to have clients agree with you more often. So there's a personal trying to see these as a way to not take things personally and to not feel so bogged down when clients are upset, right? They're upset about the situation. Usually it's not you, but when they're really upset, then what do? I'm going to reach for one of these tools. And I might say, again, sounds like you're having a really rough day. What were you hoping to accomplish with this visit? As opposed to, here's the things I'm going to do. And then they get mad because those aren't the things they can do. It's just like, let me put the ball back in your court. So using these tools, especially, use them in challenging situations to help. But I'll second Ruthanne with pick one and just practice when the situations aren't challenging so that you get really comfortable with it. And one of the things that you could start with is to, rather than do you have any questions or do you understand, both of which are closed-ended, change to what questions do you have for me? And this could be at the end of every visit. And it took me probably 2 years, and now I do it absolutely unintentionally. That is the way I ask that question, but it took me years. So there's one simple change. A lot of times people, probably because I talk a lot, say, I don't have any questions. So you're not opening up the floodgates. But it is a way to rephrase close to open that can help people feel like what they want to ask matters and might get some questions out that people would otherwise be afraid to ask.
Yes. So wonderful. I can feel your passion for this topic. It's so obvious. And the proof is in the pudding that you all are people you use it every single day, and it's changed the way you do medicine. For the people listening that might be interested in bringing in some of these tools into their clinic or practicing personally, and they want to contact you to learn more, what's the best way for them to find you or reach out?
For me, my email address.
Okay.
Laura mentioned we've done some consulting. We certainly do a lot of talks and seminars and workshops. And my email address is my name, Ruthanne.Chun at wisc, as in Wisconsin, WISC.edu. So that's probably the best way to reach me.
Okay. Yep. And same for me, Garrett, 2 R's and 2 T's and the number 1. So Garrett1 at Illinois.edu.
Excellent. I'll put that in the show notes. And I appreciate both of you for being on to talk about this. I think we did the topic justice. It's a very big, broad topic. But the feeling that you bring to I'm imagining myself as an audience member. I would feel a bit of relief knowing that there is a pathway forward, that I don't have to dread day in and day out the difficult conversations that I might have to face, to know that if I am good at learning other skills and techniques like how to draw blood, that I could also learn communication skills that would make my day much easier and more pleasant. So thank you for coming on to talk about this topic with me today. It's been really fun.
Thanks for having us.
Yeah, thank you very much. It was a pleasure.
Thank you for joining me today. I hope that you feel stoked after listening to this episode. And as always, I would love to hear your comments and feedback. Is there a topic that you want to know more about? Please let me know. And thank you again for subscribing and sharing your favorite episodes with others. It really means a lot.